Here is why it is impeccably important for healthcare providers to understand trauma. Trauma is something that is so misunderstood. It is so undereducated. Like, people do not understand how trauma is impacting the body. And as somebody who has gone through serious chronic health issues, it would have been incredibly helpful for my doctors, even my therapists sometimes, medical providers of all ranges to understand trauma. I can't tell you how many doctors I've seen, how many cardiologists I've seen, how many oncologists I've seen, and you can just feel that they are not trauma informed or trauma aware. So I believe that when healthcare providers and healthcare workers and therapists and doctors and practitioners and even Eastern medical practitioners learn about trauma, everything is going to fucking change. Everything is going to change in this world. Everything that is wrong in the medical system, I believe, can start to be fixed and cured by people learning about trauma. So here are some of the reasons why it is so important for healthcare providers to understand trauma and how it impacts each person, every single person on this planet. So first of all, I guess I should start by saying that there are some myths about trauma, right? People believe that trauma is something that is super, super serious and super significant in somebody's life that is just earth-shattering. So when somebody thinks of trauma, when a lot of people think of trauma, they think of what is called big T trauma, which is a really large, in a way, catastrophic event that completely changes somebody's life. So a lot of people think of trauma as war. Most people think about trauma as war, serious car accidents, assaults or sexual assaults, something that is very, very intrusive and life-changing and just dominating, right? What people don't understand about trauma is that there are different types of trauma, and something that I feel like is really important for especially practitioners and healthcare providers to focus on is what is called little t trauma. And little t trauma are smaller. I shouldn't say smaller because they still have a really large impact on the way that people behave, feel, think, show up in the world. But they are what people would consider to be smaller events, but they still have a very long-lasting imprint on our mind, our physical body, and our spirit. So little t trauma, an example would be divorce, especially if it's a really nasty divorce. There's financial trauma, people who are chronically poor and chronically trying to fight to survive. That is traumatic to somebody's nervous system, which I will talk all about the nervous system in future videos. It can be bullying. It can be emotional neglect as a child, or it can be like a really, really bad fight with, somebody who's really close to you in your life that ended up just being really hard and painful. And these are what are called little t traumas, and little t traumas stack up over time. And every single one of these little t traumas are getting imprinted in the body, right? And I'll talk about this later in future things, but basically, trauma is something that is ongoing for people. It is something that is constantly experienced. It is something that a lot of people don't know how to deal with, and it leads to a lot of problems that have people come in to get our support as healthcare workers, practitioners, doctors, therapists. And when we are unaware of what is happening for them, and we are unaware that what they're experiencing is a result of ongoing little t traumas, we are missing a huge piece of the puzzle. So here are a few reasons why healthcare providers need to understand trauma. Number one is that trauma can have physical health consequences, such as chronic pain, gastrointestinal problems, and cardiovascular disease. Like I said earlier, when there is an ongoing repetitive nature of trauma, trauma is stored in the physical body. It is stored in what is known as the fascia, which is a bunch of small nerve endings right beneath the skin. That is where trauma lives. It is where trauma survives. It is where trauma continues to live and impact our lives until we learn how to heal and nurture it and take care of it. And so when we are experiencing chronic pain, when we are experiencing gastrointestinal issues is a huge sign that somebody has unresolved trauma. When we have what is called the vagus nerve, it is what is connected to our brain and runs all the way down into our gut. And it is the only nerve in our entire body that connects our gut to our brain. So when our brain is experiencing a lot of ongoing stress, chronic stress, a lot of high emotions, a lot of intensity as a result of ongoing little t trauma, it is directly relating to the gut. It is directly affecting how we digest food, how we are properly digesting and moving it through us, or maybe not moving it through us and releasing it from our body. There's a lot of issues here. And a lot of people also have things like chronic pain. I personally experienced a lot of chronic back pain in my life. And it's really interesting how once I started to learn how to work with trauma, my back pain is very, very low now. I very rarely experience back pain anymore. And whether that is a combination of all the other health things that I had going on or whether it was trauma, I can't really tell for sure. But I do know that if I had not touched on my trauma and worked on moving through those things, I would still be in more pain than I am on all levels. Trauma can also affect the brain. This is another reason why healthcare providers, therapists, practitioners, chiropractors, even Eastern medical doctors need to learn why trauma is so important in the body and how it impacts us, because trauma can affect the brain, which can lead to a lot of mental health problems such as depression, anxiety, and PTSD. I am going to make a really bold statement here and say that most people on this planet who are dealing with depression and anxiety are actually dealing with the consequences of ongoing little t trauma, if not big T trauma that they have not known how to deal with or work through or care for or, take care of. I truly believe that depression and anxiety is more often than not a consequence of ongoing little t trauma. But what happens when we go to a practitioner, a Western medical doctor, an Eastern medical doctor, or a therapist who is not trauma aware and not trauma informed and does not understand how these ongoing experiences in this person's life is impacting the way that they think and feel? We prescribe them a medication. We give them pills. We tell them that this will fix it and this will happen because you have a chemical imbalance in your brain and we need to fix it. It's not fucking true. People are traumatized. And that word is so heavy and that word has a lot of weight to it, and I understand that. But our world is filled with trauma. If you think about the ongoing 2020 pandemic, this is something that radically shifted the way that people think, feel, and behave. It has changed everybody's life. This is, in a form, a type of trauma that we collectively went through all together. And now a lot of people are experiencing a lot of depression, a lot of anxiety, because people were isolated from each other. They were not allowed to be in close contact with one another. People were stuck at home to be in their own minds with tools that nobody has taught them how to use, to work through these things that have imprinted in their body, that they're feeling all of these thoughts and these beliefs and feelings that trauma has induced in the body, but that nobody has the tools to understand how to work through and how to navigate and how to heal from. So we need doctors and healthcare providers to understand how trauma is impacting the way that people feel and the way that people are thinking, because we need to stop diagnosing people with depression and anxiety and giving them medications, which is not doing nothing but re-traumatizing them potentially and making it worse, which I'll get to later, because that's a huge part. And on top of that, trauma can lead to changes in behavior, such as substance abuse, self-harm, and aggressive behavior. And again, we instantly go to this person is mentally ill, this person needs a medication, and we're giving them the wrong treatments. We are not addressing the root cause, which is that they have unresolved trauma. We are instantly going to something is off balance in your brain, and we need to fix it with this pill, which guess what? A lot of the time makes people's symptoms worse, especially if they don't fucking need it. It will make them more depressed. It sometimes can make them more aggressive, or it can completely numb them out and make them a shell of themselves. I've been on antidepressants and I did not need antidepressants. I needed somebody who was trauma informed to help me with a bunch of shit and childhood things that I had been through that I didn't realize was trauma, because nobody's aware of what trauma actually is. We need healthcare providers, therapists, doctors to understand how trauma can affect relationships, because it makes it incredibly difficult for individuals to form and maintain healthy relationships. Going through trauma is like putting on what I talk about with my clients as shit-colored glasses. You start to see the world through a lens of, rather than rose-colored glasses, it is like shit brown-colored glasses. You see everybody in front of you as somebody who's a potential threat, who is untrusting or mistrustworthy, words. You see people as a threat to your well-being and a threat to your safety and a threat to your security. And you're not even consciously aware of it. And this can really, truly impact the way that people feel and how it is impacting the way that we show up with our clients as healthcare practitioners, because clients are showing up completely traumatized, carrying around all sorts of experiences, wearing shit-colored glasses, looking at doctors. I'm one of them. I go into Western medical doctors and I'm like, you're not going to fucking help me. This isn't going to work. I'm just another number to you. You're not even really going to care. And that's something I've really had to work through in my life. But when healthcare practitioners and providers and doctors and therapists are actually aware of how trauma is impacting relationships, we won't instantly see somebody coming into a doctor and being closed off, cold, sharp, edgy, or the opposite, where they're just completely broken down crying. Like, we will start to see those things as, wow, this person probably has a lot of trauma in their body that they have not known how to work through, that they're storing in their body, and they're having these physical symptoms potentially, or these mental, emotional challenges because of it. And now it is being projected out into the relationship with me and this client, with me and this patient, with me and this human. And when we as practitioners can understand how to hold space for somebody who is probably in a trauma response, because going in to see a medical doctor when you have had past trauma can be really, really, really painful. And I'm just saying that from personal experience and from experience that I've heard a lot of my therapy clients and my coaching clients both say. It can be re-traumatizing to go in and see a healthcare provider who is not trauma-informed, and that is something I'm going to get to right now. Trauma can be re-traumatized, and if healthcare providers are not sensitive to the impact of trauma, their interventions themselves may be re-traumatizing. For example, here's an example that I've heard from working in the mental health field as a therapist. If somebody comes in to the doctor's office and they're saying that they're having just like an emotional breakdown, they don't know what to do, they're having a spiritual crisis, an emotional crisis, like they're in crisis, and we instantly throw them into an inpatient program and we throw them on medication, I have heard horrific stories about people getting 5150'd and taken to be held in a practically cell. I've heard of people being strapped down to a bed. And I want to start by saying, like, I don't know the answers to those crisis situations. Like I just know that we need to do better at being aware of what this person is experiencing, so that if we're not at least aware of how they may currently be traumatized, we're going to be aware of how we may be re-traumatizing them or traumatizing them in a new way for the first time in the medical field, in the way that we respond, in the way that we intervene, in the way that we show up and take care of this person or don't take care of this person. Something that is experienced for me, where I have been re-traumatized going to doctors, is because I have been undiagnosed with Lyme disease for 18 years, and I was going into doctor after doctor after doctor for all of these symptoms that would leave me sobbing at night because I was in so much pain and I was just so confused, and I'd have rashes all over my body and I had no idea what was happening. And I would go into the doctors and they didn't know what was wrong, so they would tell me that it was stress. And they would tell me that it was basically all in my head. And I was at that point in my life where I was meditating every single day. I was doing yoga every single day. I was journaling every single day. Like, I was doing everything that I could to take care of my mental health at that time. And something was still wrong. I knew that there was a physical aspect to what I was experiencing, but doctors were not listening to me. They were not taking me seriously. They were not taking the time to really hear me and be attuned to me. And I'll talk about something called mirror neurons in the future, but mirror neurons help people feel felt, feel seen, feel heard, feel validated. And this is something that therapists and practitioners and healthcare providers and nurses and doctors need to understand, because without that attunement, we are potentially re-traumatizing the people who are coming in to see us, because we are acting like they're another number. We are making them believe that it is all in their head. I cannot tell you how many, specifically women, have gone to the doctor and have come back with no answers, and nobody who's even following up, nobody who's even trying to help them get answers. And they're basically feeling crazy because they know that something is wrong with their body, but the doctors are not listening to them. They're not validating them. And imagine somebody who has been, for example, sexually assaulted and then feels like they can't tell anybody, and then all of a sudden they're going in with all of these really insane, physical symptoms, and they aren't telling people about what happened to them because they're so traumatized and they don't know how to say it, and they feel ashamed, they feel embarrassed. These are all things that doctors need to fucking understand, that all therapists need to understand. There's so many therapists out there who are not trauma aware and trauma informed and understanding how trauma is living in the body, and they're only working with the mental body. They're only working with the mental body and telling people, CBT, cognitive behavioral therapy, incredible, incredible tool. And it is failing to address the physical body and trauma and how it is showing up in people's everyday life. So these are some of the reasons why it is so more than important that healthcare providers understand how trauma is stored in the body, what kinds of trauma people are experiencing on a daily, hourly, minutely, secondly basis. People are constantly experiencing trauma. And when we don't know how to, first of all, when people in general don't know how to handle their trauma and don't know how to work with their trauma and don't even understand what is happening to them, that is when they get very traumatized, and then they show up to get help, and the helpers and the healers are not aware of what's happening. And so we're giving them new things, aka medications, new interventions to help, and it's actually making the problem worse, which is re-traumatizing them, which is building and increasing their lack of trust, their lack of safety, their lack of security, and we are building a traumatized world. So that is my speech. I don't even know what I'm doing on YouTube. Like, I just know that I'm supposed to be sharing this message. I'm not fancy. I don't have good cameras. I don't, but I know that this message needs to be heard. I know that people need to understand this topic, to understand this concept, to understand how we can work with these things. And that is my mission for being here. So if you are here, so grateful to have you. Thank you. Like and subscribe if you'd like to follow along for more. And I appreciate your willingness and your open-mindedness to learning about these things that is going to radically shift and change and transform our world for the better.